Welcome to Mad Medicine with Miss P on this frigid morning with 8 inches of snow on the ground, and we're all snowed in and can't go to work or anything. It's fine. Everything is fine. It's great. It is. It's gonna be okay. At any rate, I do still have like 3 or 4 pages, probably four of these little handheld pages here of good stuff. And what I mean by good stuff is the worst part of my job. And while I love these people, the things they say, it makes me want to bang my head into a wall a little bit. Like when we're asking about their medications and their dose, they always say, "Well, I'll take one," and I say, "Right, but how much is that?" And like, "Well, hold on, let me go look." Like, I can hear the pill bottles in your hand because they're shaking around. I also said we need a full list of your medication, so if you don't have an accurate written list, can you just grab the bottles? And yet they still say, "Well, hold on, let me go look." How many different places do y'all keep your meds? I'm assuming quite a few, because I'm often having to hold on while they go look. Now, this one lady, this is really interesting. See, and this is a learning episode today. She said she takes amlodipine twice a week. And I was like, I don't think that's how blood pressure medications work. But you know what? I looked it up. And technically, the half-life of amlodipine is like 30 to 50 hours. So you can kind of take it 2, 3 times a week. And there's still like a little something in there kind of doing its job, which I thought was really neat. Because usually when a patient says they take something for blood pressure, like once in a while or as needed, it's Lasix. Like if you're taking your Lasix only when you have swelling in your feet, that's not how kidney failure works. But I could use a little Lasix right now. I've been binge watching a TV show and just eating my weight in mac and cheese, so I could probably use a little 40 Lasix. Now, I have a very open mind. After that, like I said, after these past 3 years, at this point, I'm like, okay, you can come up with any crazy random conspiracy theory. And I'm like, you know what? Okay, I'm going to keep an open mind. So when this patient told me repeatedly that my crystals have come loose, I thought for a minute if he meant like his fillings in his teeth, or maybe caps or crowns. Maybe he had his electrolytes drawn and they were all wacky or something. But he said it so many times that his crystals have come loose that I don't know what that means. It seems very interesting, and I would like to know where he went with this, but I really don't know what that means. Now, I've heard my crystals are out of line. That could still be electrolytes, or it could very well be crystals that they keep at home, which, fine. I carried around rose quartz for a while just so I wouldn't have to marry a loser, and it kind of worked out. I I got married alrighty, and one of these days I'm gonna know that rose quartz really did the job. He's a hardworking, sweet, sweet man that just won't wipe down the counters after he makes a mess of sticky, crummy stuff. He's never gonna do it. I've accepted it though. It's been like 28 years. I've come to terms. Another person said that she thinks she has some heart problem. Literally, this like 26-year-old child thinks she has some sort of heart problem because when she lies down and then sits up real quickly, she gets dizzy. Could someone maybe explain to this child how orthostatic hypotension works? If you haven't ever squatted to pull weeds for a good 2 or 3 minutes and then stood up quickly and realized it was a bad idea, then you don't have a heart problem. You have a normal working human body. God bless her. Now, I'm sure you've heard this before, but it still makes me giggle all the same. What kind of surgery are you having on Monday? I got a Cadillac in my left eye. Is there a Rolls Royce in your right? Okay. Take out the Cadillac in his left eye. Oh, yes. And then this person, oh God, you know what? I want to write this down for you because I realize nobody can spell tonsils, which again, not a surgery. It's a part of your body. But I'm sure they mean tonsillectomy, but still, that's fine. But this person had their tonsils and their gonoids their tonsils and their gonoids removed. They had a tonsillectomy and a gonoidectomy. Yep, those gonoids are out of there now. No more gonoids on that person. Surely it's adenoids, but still. It literally said that. That's why I like it so much. Oh, and then this other, same person. You know what? I remember this kid. He was like a, I don't know, 24-year-old guy. He was coming in. Now listen, you know I can't spell either, but I have a computer in my hand and I can look this up anytime I want, especially when it's going in like a legal document or, you know, your health history. He was coming in because he had a labral tear. A labral tear. He had the labral tear. So we fixed him up. Good. He's fine now. Also, when they hand you a list from the doctor's office and say stop these medications 3 days before surgery or 5 days before surgery, I promise, spread the word here, I promise, it's never diabetic or blood pressure medication. It's really never going to be a psychotic or surgery medication or antipsychotic or antidepressant. None of those medications you have to stop before surgery. And please, for the love of God, take them as you should. Those meds you should never stop. So when I call you and you say, yeah, you told me to stop everything 3 days before surgery and that was all your diabetic medication, nobody told you that. Nobody on earth would tell you to stop your diabetic medication unless you had a really high life insurance policy claim and your spouse maybe wants you to stop your diabetic medication. No, nobody else would do that. I promise you. Oh, and then this, you know how I hate that box. The things of how to take good care of you. Again, that box is specifically what can we do to make your stay at this center even better? What is specific? What issues have you had in the past that aren't on the 200 question essay? Something that's very specific to you. This guy, I'm not exaggerating. He is morbidly obese, has insulin-dependent diabetes, CAD, hypertension, drinks 6 alcoholic drinks a week. And I recently learned how bad alcohol is for you. So you regular drinkers, I know, but cut back because this podcast is making me feel like I'm going to drop. Apparently, according to them, because I get up at 2:30 in the morning, I'm going to die 15 years earlier than everybody else, than your average person, I guess. And the whole alcohol thing, you don't want to know. I don't drink much, so it didn't scare me. But he also has hyperlipidemia with bilateral stents, CAD with bilateral stents, depression. And in the box, he wrote in there, don't kill me. I feel like you're doing a good enough job of that. You're really hitting all of the bases. Now, if you tell me you also are like I don't know, motocross enthusiast or something, like I don't know what else we could do. Are you a smoker? Start smoking, and then you're gonna just hit all the bases. You have a much better chance of killing yourself than us killing you. We don't kill people to surgery center. We're just gonna do your surgery and you're on your way. Maybe you're trying to be funny, but I think the stupidity outweighs that funny there. Nobody smiled at that. It's just dumb. Oh yes, this patient put in that box. God, I hate that box. Follow all prescribed medical processes for cataract surgery. What in the hell does that mean? Follow all prescribed medical processes for cataract surgery. What is she saying? Don't get creative? Do you think we don't have a routine? We do like 90 of them a week. Do you think we don't have a routine? God bless that. That was a Karen. If ever I heard a Karen, she's asking for the manager. That one is asking for the manager. Oh yes, a patient also said in their surgery list that they had to remove one of my cysts. All the other cysts could stay, but one of them had to be removed. One of my cysts. I have to ask them, what do you mean by that? I'm pretty sure, I don't remember because I don't know how old this was, but I'm pretty sure she meant one of her ovaries because maybe it had a cyst. Don't get me started on the whole ovarian cyst thing. That's like how you ovulate, at any rate. Oh, yes. This guy has heart palpitations and had an ablation. Uh, and oh, he said he had heart palpitations and an ablation fixed it. I mean, you had AFib and ablation fixed it. We don't do ablations for palpitations. I feel like if I had a problem with my heart, and I'd like to think that even if I wasn't a nurse, I feel like I would listen when people spoke and I'd have an idea of what was actually going on. Because the amount of people that think they have an arrhythmia and then have no idea what it means. Well, they didn't say. They did. They said, and it was in your chart. And if you ever asked for uh, your records, you would know exactly what that was. But you don't want to know. You think it's not important. You're just going to trust your doctor to figure that out. And then what's going to happen is that something is going to go horribly wrong at some point, and you're going to want to blame him 100% or her instead of you learning about your own medical history. This patient, this is the trifecta. She had a tubal, then she had a gall bladder, then she had an oblation. Now you realize we can oblate. You can have an ablation on like any part of your body. We could heat up and burn out any part of your body. So when I ask what part of your body was ablated, and they're like, my heart. Okay, well, we could ablate your cervical spine, your thoracic spine, your lumbar spine. We even do them on knees. You can do a cardiac, a uterine. We can ablate anything. So you're going to need to know what part of your body was ablated because it makes a big difference. But this other patient told me that I was told I had angina. I'm sorry, someone told you had chest pain? You were having pain in your body, but you couldn't figure out what part of your body it was. So you went to the doctor. The doctor's like, honey, your pain is in your heart. You're having angina. Even that diagnosis, angina, we've talked about this before. That, chest pain, angina, especially when it's cardiac related, that's when it's like, diagnosed as angina. Even still, y'all understand where the pain in your heart comes from, right? Lack of blood flow, like tissue death. It's not like a syndrome, or you have coronary artery disease. The symptom of that is angina. Can a cardiologist comment and school me a little bit? Because I see it often enough to where I'm clearly missing something. I don't understand. Oh, you have a little chest pain. Yeah, here's the nitro. You'll be fine. What does nitro do? Yeah, it opens up the vessels that lead to your heart muscle, so it can flow freely. So that tissue stops being strangulated, being strangled and dying. That's what. That's the 3 eyes. Remember we talked about that. I don't understand, but it's fine. Everything's fine. It's gonna be fine. Hydrocodone gave her a blood clot. Hydrocodone. She took a Lortab and got a blood clot. You mean you took a bottle of them, lied still for hours at a time, and developed a blood clot? I don't know. First of all, that's not an allergy. It's not a histamine response. It's nothing like that. And I would love to know what actually happened at that time, because I could almost promise you that that's not directly related, but maybe it is. Maybe there's something out there that it's known to create blood clots despite it having nothing to do with clotting factors. I don't know. They had a fiber tumor and had a half hysterectomy. They left an ovary. You don't know how I feel about this. I could talk about this on every single video. There's no half hysterectomy. There's no partial hysterectomy. Your uterus is either removed or it's not. That's all there is to it. Your ovaries and your tubes are completely different organs. How come nobody ever says like, they took my gallbladder out but left my liver? Yeah, because it's a completely different organ, and it's just because they're working together or close to each other. That has nothing to do. I'm sure that was the same doctors, the whole partial hysterectomy thing was the same doctors that created white coat syndrome. Oh, yes. And this patient was allergic to aplicicillin, also penicillin, apicillin, ampicillin and penicillin. Both of those? Yes, it's the same drug. Oh my God, you guys, there's a total entire page on the other side. I told you, I've got content forever, and then I'm going to pray I can get to work tomorrow, and we'll do some more. All right, I'm out of here. Same as always, face your fears, forget your failures, follow your faith. Love y'all. See you next time.